Hi, this is Dr. Goya. We're doing the head-to-toe assessment. This is the area that I am working in. There's no one behind me, and there is a chair that I will be sitting my laptop on. I do have a table over here on this side. Here is my patient, and on this corner over here, I have my small eye chart. There's no one in that hallway. Okay, I do have the documentation needed for head-to-toe on me. There are no notes written. Alright, should we start?
Yes. Come in.
Hello, my name is Lexi Goya. I am a student nurse here at Texas Tech University. I have been assigned to do your head-to-toe assessment. Is that okay?
Yes.
Okay, awesome. Before we start, can I have your name and date of birth?
My name is Maria Garcia. My date of birth is April 1970.
Okay, thank you very much, Ms. Garcia. And can you tell me a little more on why you need a head-to-toe assessment?
I was required by my employer to have a physical exam.
Okay, thank you very much. So before we start, I'm just going to close these curtains, provide us some privacy. Alright, and I'm going to perform hand hygiene. Alright, so the first thing we do to start is actually just see your arms now. Okay, on inspection, I see that your skin is uniform in color. There are no lesions noted. Alright, I'm going to feel your skin with the back of my hand. Your skin is warm and dry to touch. I'm going to give you a quick pinch right here. There is no tinting noted. Alright, I'm going to see your nails again. Your nails are clean and hygiene is adequate. I'm giving a quick pinch. Capillary refills is less than 2 seconds. Alright, and can you make sure? Can you do this motion? Alright, and there's no clubbing noted. Alright, now I'm going to be assessing your head. I'm going to be palpating, so if you feel any tenderness, please let me know.
Okay.
Okay, on inspection, your hair is well groomed, well distributed. There is no evidence of pediculosis, no evidence of protrusions, and no evidence of indentions. Alright, and did you have any tenderness now popping your head?
No.
No tenderness? Okay. And there are no tenderness to all areas of the scalp. Alright. Now I'm going to be palpating your temporomandibular jaw, man. Can you open your mouth? Close your mouth. Okay. Temporomandibular jaw is free of crepitus. Now I'm going to be palpating your temporalis and your masseter muscles. Can you clench your teeth, please? Unclench. Okay. Temporalis and masseter muscle are equal in strength bilaterally. They're equal in strength bilaterally. Cranial nerve 5, trigeminal nerve is intact. Okay, now I am going to be popping your sinuses now. Maxillary sinuses. Can you let me know if you have any tenderness?
Okay.
Alright, and frontal sinuses.
No tenderness.
Okay. Alright, maxillary and frontal sinuses are non-tender. Can you do me a favor? Can you close your eyes? And can you let me know when you feel this?
Now.
Okay, how?
Now.
Okay. Light touch is noted. Cranial nerve 5, trigeminal nerve is intact. And can you look at me? Can you frown? Raise your eyebrows? Puff your cheeks? And smile? Okay. Thank you very much. Cranial nerve 7, facial nerve is intact. Alright, ma'am. Now I am going to be looking at your eyes. Alright. On inspection, your eyebrows are symmetrical. Your eyelids are intact. There is no redness or swelling noted. And your eyelashes are evenly distributed. Alright. Can you stand up for me real quick, please? Can you cover your right eye? And can you read the sign?
LEFODPCT.
Awesome. And can you cover your other eye? Can you read the same line, line 9?
LEFODPCT.
Okay, awesome. So visual acuity is 20/20 on both left and right eye by the Snellen chart. Just a note from my instructor, I'm aware that in a real life situation, my Snellen eye chart will be farther, about 20 feet away. Before this assignment and due to my limited area, it's a little bit closer, but I'm aware that in a real life situation, it will be farther. Okay. Alright, ma'am. Now I am going to be inspecting the internal structure of your eye, so I'm going to be pulling down your eyelids. Your conjunctiva was pink and moist. There are no lesions noted, and there was no excessive tearing with your eyes. Your sclera is white. Your irises are round and symmetrical, and there are no lesions noted. I am going to be flashing my light in your eyes real quick, ma'am, okay? Okay, corneal light reflexes are noted bilaterally. Alright, I'm gonna flash my eyes, light in your eyes again now. Okay. Pupils are equal. They are round. They're equal, round, and reactive to light. Can you do me a favor? Can you follow my light with your pen? And can you follow my pen with your eyes? Okay. There is accommodation. Alright, now can you do me a favor? I'm gonna be moving my, okay, follow my pen with your eyes one more time. Just don't move your head, you follow your eyes. Move left. Move right. Move up. Down. Up. Down. Up. Down. Okay. Cranial nerve 3, ocular motor. Cranial nerve 3, ocular motor, superior, inferior, oblique, inferior, and medial rectus. Cranial nerve 4, trochlear, superior oblique, and cranial nerve 6, abducent, lateral rectus are intact. Alright, now ma'am, I am going to be inspecting your ear. I'm going to be palpating, so if you feel any pain, please let me know. Going to check inside. Alright, and do you feel any tenderness?
No, not tenderness.
Okay. The pinea is free of any masses or lesions. There are no. Pinea is free of any masses or lesions. There is no discharge, and there is no tenderness to palpation bilaterally. Alright, so I'm going to now be standing behind you, ma'am. Thank you. And I'm going to be closing your ears. Alright, can you do me a favor and just repeat the words I whisper, okay?
1, 2, 3. ABC.
Okay, thank you very much. Whisper words were heard. Okay, now we are going to be checking your lymph nodes, ma'am, on your neck. So I'm going to be palpating real quick. Alright, this is pre-auricle, post-auricle, occipital, tonsillar, submandibular, submental, superficial cervical, posterior cervical, deep cervical, and supraclavicular. Okay, all lymph nodes were non-palpable and non-movable. Alright, and now we're going to be testing your range of motion now. If you do me a favor and follow along with me. Okay, can you flex your neck down to touch your chin to your chest? Okay, and can you extend your neck up and kind of flex your neck towards your chin towards the air? This guy. Okay, full range of motion is noted to the neck. Alright, can you follow my motions? We are going to bring our arms above us and touch them together. This is abduction, with a B, abduction. Now we're going to bring them down back to our body. This is adduction. Okay, now can you bring your arm kind of towards, yeah, exactly. Can you bring it to, bend it by the elbow? And now we're going to rotate outwards, and this is external rotation. Now we're going to bring it back in, internal rotation. Now, okay, now do your left arm. Now do your right arm. Now do your left arm. And now we're going to do the same thing, rotate outwards, external rotation, internal rotation. Excellent, thank you. Full range of motion to the shoulders is noted. Now we are going to, can you do me a favor? Can you extend your arm forward, straight like that? Okay, this is pronation. Now we are going to rotate with the palm facing upwards, this. supination. Now we're gonna be bringing the palms down forward again. Pronation. Pronate. Okay, and bring your palms up one more time. Can you flex your arms and bring it in and bend them in? Flex, and then we're gonna extend them again. Okay. Full range of motion to the elbow is noted. Can you do me a favor? Can you extend your arms one more time? And this time from your wrist, can you flex your wrist down? Can you extend them straight? Can you hyperextend them up? Okay, thank you. Now extend them straight again. Now we're going to rotate from your wrist and bring your fingers inwards. This is going to be ulnar. No, I'm sorry. This is going to be radial deviation. And now we're going to kind of do the opposite and rotate outwards. And this is make a U. This is ulnar deviation. Okay. Thank you. Full range of motions to the wrist is noted. Alright, now I'm going to be standing right behind you again now. I'm going to be placing my hands on your shoulders and kind of shrug against my hands. Okay, thank you very much. Now I'm going to be placing my hands on your jaw. Can you turn your face towards my hand? Okay, and on the other way. Awesome, thank you very much. Cranial nerve 11, spinal accessory is intact. Okay. Alright, so now I am going to be inspecting your lungs and your thorax. Can you do me a favor? Can you lift your shirt? Alright, and can you raise one arm? Up over here, and look. Okay, and can you turn around? You facing your back? Okay, thank you very much. Anterior, posterior, and transverse ratio is 1 to 2. Thank you very much. And now I am going to also, we are going to I will be palpating your, I'll be palpating your, okay, I'm sorry, I linked that for real quick. I'm going to be palpating your, posteriorly, anteriorly, palpating your back and your abdomen. Can you do me a favor and let me know if you feel any tenderness? Can you take a deep breath?
No tenderness.
No tenderness? Okay. Now I'm going to be doing it. Can you take a deep breath? Okay. Chest expansion is symmetrical and equal. There is no tenderness noted. Now I'm going to be listening to your lung sounds. Alright, now I'll be oscillating. Every time I move my stethoscope, can you do me a favor? Just take a full breath. Okay. Thank you. Alright. Now you're back. Can you just stand up and face that way? Okay, take a deep breath. 1, 2, 3, 4, 5, 6, 7. Alright, I'm gonna be lifting your shirt from the back real quick. 9, 10, 11, 12, 13, 14, 15, 16, 17, 18. Okay. Thank you very much. Vesicular sounds are clear on all lung fields, and they were equal bilaterally. Then there was no adventitious sounds. Okay. Now we are going to be Now I'm going to be inspecting your heart map. So can you do me a favor? Can you just split the picture real quick? Okay, after inspection, there were no abnormal pulses noted. Okay, now I am going to be palpating your heart. Here we go. Okay, this is your aortic, pulmonic. This is Ayres point, tricuspid, and mitral. Okay, alright. And after palpation, there were no heaves or thrills noted on your aortic, which is on your second intercostal on the right side. There was on your pulmonic, which is on your second intercostal on your left side. On the Ayres point, which is on the third intercostal on your left side. On your tricuspid, which is between the fourth and fifth intercostal on the left side by the lower left sternum border, and on your mitral, which is on your fifth intercostal on the left by the midclavicular line. Okay. Now I am going to be feeling for apical pulse a bit. It's going to be on your mitral. Just to be sure, but okay. Apical impulse on the fifth intercostal by the left midclavicular line. There are no thrills. Okay, now I am going to be auscultating your heart phenomena. I'll be using the diaphragm of my stethoscope to listen to your apical, pulmonic, Ayres point. Can you look at your shirt real quick? Tricuspid. And your mitral. Okay, S1 and S2 were heard. They were non-diminished. No S3, S4, or systolic or diastolic murmur heard. Alright, now I'm going to be listening to your heart again, but this time with the bell of my stethoscope. Your aortic, pulmonic, Ayres point. Hands for your shirt. Tricuspid. And mitral. Okay. S1 and S2 were heard. They were non-diminished. There was no S3 or S4, systolic or diastolic murmur heard. Okay, now if you could do me a favor, can you lay on the couch? Okay, and now I'm going to be inspecting your abdomen. I am going to be providing you the drape. Thank you very much. So that I can cover up any areas not needed. Okay. Alright, so upon inspection, the abdomen is flat. It is symmetrical. There are no lesions or scars noted. And I'm going to be listening. Lower. Thank you. I'm going to be listening to the right lower quadrant. Right upper quadrant. Left upper quadrant. Left lower quadrant. Okay. Vowel sounds are present on all four quadrants. Now I'm going to be percussing. Right lower quadrant. Right upper quadrant. Left upper quadrant. Left lower quadrant. Okay. And timpani predominates all quadrants. Alright, and now I am going to be palpating. Let me know if you feel any tenderness. Right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Okay. Abdomen is soft. There are no masses noted. Did you have any tenderness, ma'am?
No.
Okay, and there are no tenderness on palpation on all quadrants of the abdomen. Okay, and while you're doing there, I'm gonna check your lower extremities. I am going to first. I'm gonna inspect them. Your skin is uniform in color. Okay, I am going to feel your leg with the back of my hand. You are warm and dry to touch. I am going to be feeling for your tibialis pulse, ma'am, on both legs. Tibialis pulse is 2 plus, and they are equal bilaterally. I am going to be feeling your dorsal pedis pulse. Dorsal pedis pulse is 2 plus, and they are equal bilaterally. I am going to pinch your toes real quick, man. Capillary refill is less than 2 seconds. Alright, and now I'm going to assess for swelling. Okay, and there is no edema present. Alright, and can you just lay there and can you close your eyes? Alright, I am going to let me know when you feel it.
Now. 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 Now.
Okay. Light touch is noted on both the arms and the legs. Alright, you good there? Thank you. Okay. Now can you do me a favor? Can you stand up? Now, kind of copy my motion. But what I want you to do is I want you to extend your arm to this, and you're gonna close your eyes right now. But before that, you are going to bring your fingers to your nose in alternate arms. Okay?
With my eyes closed?
With your eyes closed, please. All right, go ahead. Okay, thank you. Rapid alternated movement and finger to nose test is smoothly intact. Thank you very much. Now we are, can you move? You're kind of gonna walk like this. It's gonna be heel to toe. Kind of like heel to toe, heel to toe. Okay, yes. Heel to toe, heel to toe. Okay, thank you very much. Tandem walking was done without losing balance. Alright, can you move? Can you put your arms side to side? Feet together. Close your eyes. Alright, and don't worry, I'm gonna just hold you here for a couple seconds, and I'm right by you, so no worries. Okay, my patient did not lose her balance. The Romberg test is negative. Romberg test is negative. And now we are going to do. Now you can do me a favor. Can you just kind of walk towards me and walk back? Okay. And you take a seat right after. But your gait was smooth and coordinated, and your arms swung freely. Alright, and the last thing that we do for your system is now I'm going to check your reflexes. First, I'm going to check your bicep reflex. So can you do me a favor? And can you give me your arm? Can you face me that way? Okay. Now I'm going to hit my fingers, and I'm going to be full for the reflex. Do one more time. Okay. Undo the other arm. I hit my fingers. Okay. Okay, good. I'm doing flat. Bicep reflexes are 2 plus, and they are equal bilaterally. Now can you sit over back? Alright, and now I'm going to check your patellar reflexes. Okay, patellar reflexes are 2 plus, and they are also equal bilaterally. Alright, And with that, ma'am, that concludes our head to toe test. Is there any questions that I can ask you have?
No, everything was great. Thank you so much.
Okay, and we're done. Now I'm just gonna go and perform hand hygiene. Alright. And thank you very much, ma'am. And you have a good day.
You too. Thank you.
Thank you.